Hello, my name is Helen Lamont Smith. I'm Head of Commissioning at Blackpool Clinical Commissioning Group. I've been involved with working with people with learning disabilities and commissioning services for them for several years. We aim at the CCG to ensure that everyone is able to access services and gets the right help and support that they need. The service users and carers who sit on the Learning Disability Partnership Board at Blackpool have become very vocal about letting us know what they think about services, and this is something that we've used to ensure we commission people to help and improve things for them. Empowerment are one of the services who've worked very closely with people with learning disabilities to ensure that information is understandable and to understand how services work within the hospital setting. They've also helped to make reasonable adjustments for people and to educate staff themselves about what it's like to have a learning disability and how people prefer to be treated. At Blackpool CCG, we are highly committed to ensuring that our services do provide equality and inclusion for all people in Blackpool. We found this has been a really exciting project, working with empowerment and people with learning disabilities, and we continue to commission other services such as dementia advisors and peer support. So we anticipate that there'll be lots more interesting projects happening across Blackpool in the future.
Hi, my name's Emma Gregson. I'm the Community Assistant Resuscitation Officer for Blackpool Teaching Hospitals. Part of my role is to develop training out in the community, but also working within Trust as part of a multidisciplinary team.
Hello, my name is Lorraine Kirkland-Smith. I am the Self-Advocate Coordinator for Learning Disabilities here in Blackpool at Empowerment Charity. Part of my role is to provide support to people with learning disabilities to ensure that their voice is heard with regards to the services that they access in the Blackpool area.
Hello, my name is Sandra McWicker. I'm the Learning Disability Acute Liaison Nurse at Blackpool Victoria Hospital, and I also sit on the Integrated Learning Disability team at Progress House. Part of my role within the hospital is to support patients that come in that have a learning disability. I look at supporting the staff around raising knowledge and awareness of what a learning disability is and how we can improve the care that we give. So we look at things like accessible information, making reasonable adjustments to somebody's pathway of care, and improving communication across sort of the multidisciplinary setting.
Here in Blackpool we have a self-advocate forum called Speak Out, and it was coming to our attention that there was quite a few different issues at the local hospital where people wasn't being listened to or things wasn't explained properly. So from that we got in touch with the acute liaison nurse, which is Sandra, and discussed how we could make the services better.
So one of the first things I did was I attended the Speak Out meeting, and we talked about how we could improve patient experience. So one of the things we looked at was a really difficult, sensitive topic around do not attempt cardiopulmonary resuscitation.
I was involved, Sandra involved our team up at Blackpool Teaching Hospitals, and we think it's a really good idea developing the leaflet. Because as Sandra said, it is a really sensitive and difficult topic to discuss, but it just enables the subject to be communicated more effectively.
So from that we opened up the discussion to the Speak Out forum and asked would people be involved with producing the document what is now being provided with what happens if my heart stops. Everybody got together at Blackpool Hospitals and they met up with Sandra and her team.
So what we did was we booked out the Simulation and Skills Centre, and we acted out sort of a scenario really about what would happen if your heart stops, and we got everybody involved in that. So it was a piece of joint working with the Resus team, the self-advocacy group and myself to look at how do we improve this information.
So from the self-advocacy group, I think there were quite a number of people who had experienced these types of issues up at the Trust, so I think it was good to have those as part of the team in order to actually convey or help us convey the message that we wanted to achieve. And I think overall it's a simplistic, easy read guide, but I think it's not just for this specific group. I think it could be used for everybody.
Yeah.
So
it's enabled people to understand specific issues and therefore give a person an informed choice of what they would like to do with their lives and with their health.
One of the things that was really good about it was we looked at the people that were involved originally had poor experiences in the hospital setting, and this I suppose turned it into a really positive experience for them because they was doing some joint liaison, joint working with everybody, and we had a little bit of fun as well.
Yeah, it was good fun, yeah, and the involvement, the engagement from the guys that came along was fantastic. And I think overall for us as a department, it allows us to target training specifically around the subject of do not attempt resuscitation in order to try and maintain compliance and actually increase compliance from a point of view and what's right and what's wrong on that form.
The group also feel that we've achieved that after so many years of trying to explain to people how important it is for clear guidance, that now people are starting to listen and things are being produced.
And another really positive thing that's come out of it is we've been approached by the LD Health Network to gain consent from the people involved to adopt it on easyhealth.org. So that's really good.
So it's been a good, positive experience already, hasn't it?
Yeah.